Hi, I'm Christopher DuCoin, Professor of Surgery at the University of South Florida and Chief of GI and General Surgery. I'm also an esophageal surgeon, and we wanted to make a video today to explain to you esophageal cancer. It's a scary disease and a scary diagnosis. Thus, I hope this information helps you a little bit, and I look forward to meeting you in clinic. When you're first diagnosed with esophageal cancer, this usually comes through a biopsy or an upper endoscopy where they took some tissue. Once we have the diagnosis, we'll look to see which type it is. Is it squamous cell or is it adeno? You don't need to worry about any of this. We're going to walk you through the process. Once we have the biopsy, you'll get staged. Staging esophageal cancer usually utilizes a PET scan or CT to make sure the disease hasn't spread anywhere else, such as organs like your lung or your liver. That would mean it was metastatic. And then we'll do something called an endoscopic ultrasound, or an EUS. And that'll be a scope that goes down your mouth and really looks at, are there lymph nodes involved or how deep is the tumor? With those two modalities, we'll be able to stage you. If, unfortunately, it is stage 4 disease, surgery is not an option. Only chemotherapy is. And you'll work with our medical oncologists. We've got a robust team of medical oncologists, radiation oncologists, and really use a multidisciplinary approach for your tailored treatment plan. Now, as long as it hasn't spread, we'll discuss surgical options. Surgical options are really the only opportunity for cure. That being said, we almost always treat up front with chemotherapy or radiation. That's called neoadjuvant treatment. Depending on what type of cancer you have and the stage, you'll either get chemotherapy alone or chemotherapy plus radiation. That will last a few weeks, somewhere between 5 to 6 weeks, and then we'll pause everything, let everything cool down from the chemotherapy, and then we'll restage you with another scan and maybe another EGD. There we'll develop a surgical plan. Usually, we'll do either a partial distal esophagectomy or a total esophagectomy. These are large operations, but we can almost always do them with an MIS, or minimally invasive approach, and I use the Robotic platform, which is new technology, the Da Vinci robot, which I'm sure you've heard about. We'll do that for the abdominal and the thoracic part. Now, that surgery can take me anywhere from 4 to 6 hours to do, but I will be there with you the entire time, and I perform the entire operation. You'll meet my team though too. I've got a large, robust team dedicated to the care of patients with esophageal cancer. You'll meet our mid-level providers, which are our nurse practitioners and physician's assistants. Some of them are specifically dedicated to this disease process. You'll meet fellows, residents, and medical students, individuals training to either learn how to do surgery or this operation. At the same time, you'll have the opportunity, if you desire, to meet our dietitians and even our psychologists. We want to be here to help you in all aspects of this disease process, from the cancer to your health to your mental health as well. Now, while it is a long operation, plan to be in the hospital for somewhere between 10 to 14 days. In the best case scenario, you go to the ICU after the procedure. You're usually there 1 to 2 nights, and then you move out to the standard private surgical bed. You're going to wake up with tubes coming out of everywhere. You'll have a tube coming out of your nose, decompressing the new rebuilt esophagus. You'll have a tube coming out of your chest, which we call a chest tube, helping the lung re-expand. During the operation, I have to actually decompress the right lung for a short period of time while I perform the operation in the chest. Everybody gets a feeding tube. I tell you, medicine, your first medicine is nutrition. So we're going to give you feedings via this tube the day after surgery. You'll also have a small drain that comes out the other side of the abdominal cavity that goes up to where we just did the reconstruction. Over the few days after the operation, we'll slowly take these drains out. When you go home, you'll usually go home with the feeding tube, which can be there any for 2 to 3 months after the operation until you're getting enough calories by mouth that we can remove it safely. And there'll be another drain on the right-hand side of your abdominal cavity. It will take out usually 2 to 3 weeks after the procedure, but in the clinic setting, not in the hospital. While you're in the hospital, we'll take the highest level of care of you. There'll be people who see you 3 times a day, and there's always a physician from my team in the hospital 24/7. I want you to know, while this is a scary diagnosis, we are here to treat you, care for you, and walk you through it. We'll answer any questions you have and understand the level of impact this has on you, your family, and your loved ones. We are here for you, and this is something I am very passionate about and want to be there for you. I want to celebrate the win, your success, and your ultimate cure. Thank you for trusting me with your care, and I can't wait to meet you.